Morning. I hope the weather is as nice everywhere else as it is in Vancouver. Good stuff. Okay, shall we get started?
Sure.
Okay, great. Good morning, everybody. Welcome to the UBC Learning Circle. My name is Catherine Berry, and I'm actually the program assistant for the UBC Learning Circle. Crystal Morris is normally the facilitator, but she couldn't be here this morning, so she asked me to sit in for her. I'm normally behind the camera. I don't often get in front of the camera, so I'm really excited to be here this morning, and I wanted to thank you all for coming and for sharing your time with us this morning. And I also wanted to welcome you to beautiful downtown Vancouver and the home of the Musqueam territory. And it is my pleasure to introduce Amanda McNally this morning, and she's going to be doing a workshop and a presentation on breast health. So I'll just tell you a little bit about Amanda before we get started. And what I'd also like to do is go around the communities and find out who's in the circle with us this morning. So just a little bit about Amanda. Amanda is the Community Relations Coordinator at the Canadian Breast Cancer Foundation for the BC and Yukon region. So before joining the foundation in a staff capacity, Amanda was the volunteer run director for the Canadian Breast Cancer Foundation CIBC Run for the Cure for 3 years. Amanda has been involved with the run as a participant and a fundraiser since losing her mother to breast cancer when Amanda was 16. Amanda's passion for the cause comes from her desire to create a future without breast cancer so that her children never know what it is like to lose their mother to breast cancer. So Amanda, thank you so much for coming in today.
Thanks for having me.
Very excited that you could be here. So just before we go around the room and we find out who else is in the circle with us, I'd just like to remind everybody that we are filming this session on video conference because we do use it as a learning resource for people who weren't able to join us today, or for people who would like to learn more about breast cancer in the future. So we are going to be sharing this information with everybody who comes to our website. So I just wanted to mention that. For our folks joining us by Adobe Connect, we have a couple of different technologies going on here. I know that you guys can see us and you can hear us, but unfortunately we can't see you on Adobe Connect, so you'll be able to communicate with us and to ask questions of Amanda by typing into the chat box. You'll see on your screen that on the lower right hand corner there's a little window, and you can just type your questions in there as we go along. And the same for video conference. If you guys have a question as Amanda is speaking, feel free just to wave because we've got you on mute right now. So once we see you wave, we'll say hello, and then you can turn your microphone on and feel free to ask questions. So that's the housekeeping out of the way. And with that, I'd like to turn it over to Amanda, and here we go. Thanks for joining us.
Great. Welcome, everybody. Thanks for having me come and participating in this conversation about breast health. Essentially, what Breast Health 101 is a just overview of breast health. We're going to cover risk factors, early detection, prevention, talk about the importance of mammography, and hopefully you walk away with the tools that you can utilize now and share in your communities for people with things that they can do right now with the information. So feel free to ask questions or make comments as we go along, and we'll get started. So as Catherine mentioned, my name is Amanda McNally. I'm the Community Relations Specialist with the Canadian Breast Cancer Foundation, and this is what I do. I go out into the community, I do health promotion, I speak at lots of health fairs and workplaces and community events, essentially just sharing breast health information because we really believe that knowledge is power. Next slide, please.
Okay, I'm just going to switch it so everybody on video conference can see it.
So first of all, if you're on social media, we have a Facebook page and a Twitter. So we'd love for you to join us and follow the conversation. We post all our latest events, research breakthroughs, lots of pieces of information, advice, healthy recipes, survivor stories, all on our social media pages, so we'd love for you to join us. Next, please. So just to give you a little bit of background about the Canadian Breast Cancer Foundation, We are the leading community-driven breast cancer charity, and we're dedicated to funding relevant and innovative research and also supporting and advocating for the breast cancer community. I just want to point out that when we say breast cancer community, we don't mean simply people affected by breast cancer. We mean anyone that participates in the community, whether they fundraise, they donate, they advocate, volunteer, participate. Anybody who's impacted by breast cancer is part of the breast cancer community. Next, please. So our vision, next please, sorry, all the fancy graphics, is creating a future without breast cancer. So when we say this, we don't necessarily mean just that a future without breast cancer altogether. We mean a future without the fear of breast cancer. When we get to a time where breast cancer is a manageable and easily treated disease, a time where a woman who is faced with a breast cancer diagnosis can think to herself, thank goodness it's only breast cancer. Next, please. So a few breast cancer stats for you. Keep in mind these are last year's stats. The newest stats should come out shortly. But breast cancer is still the most commonly cancer diagnosed in women, and it's the second most common cause of cancer death next to lung cancer. Estimated 22,700 cases were estimated for 2012, with 200 being diagnosed in men, and 5,100 deaths, which sounds like a high number, but it's important to note that that's the lowest since 1950. 55 men will die from breast cancer, and in BC alone, 3,000 women will be diagnosed with breast cancer, with 630 deaths in BC. The good news is that the incidence rates have remained level for the last 20 years, and death rates have decreased by 30% since 1986. So it seems to a lot of people that the incidence rate has increased because it's more commonly talked about and discussed, but the incidence rate has actually remained the same. I think it's that we're breaking through those barriers of women being ashamed or embarrassed or uncomfortable talking about it. So I think that it's that we're hearing about it more as opposed to it actually occurring more. And then the great piece of news for us here in BC is that in BC we have a 5-year survival rate of 91.8%. That's the highest in Canada and arguably the highest in the world. So if someone you know or yourself is going to be faced with a breast cancer diagnosis, this is absolutely where you want to be. Next, please. So just talking a little bit about what breast cancer is, we know that breast cancer is an uncontrolled growth of abnormal breast cells, and that cancer occurs as a result of mutations or mistakes that happen and abnormal changes in the genes. And those are the genes that are responsible for regulating the growth of cells and keeping them healthy. Something affects this and the process gets disrupted and they keep multiplying. It can happen in the lobules that produce the milk or the ducts that drain the milk from the lobules to the nipples. Next, please. So this image shows you the breast anatomy. It shows you where the lobules and the ducts are. The important thing to note on this slide as well is the outlined white area shows you where your breast tissue is. So that entire area, all the way up to your collarbone, down to the breast itself, under your arm, and even this part of your arm as well is all breast tissue. This is all the area that you need to be checking. It's not just simply the very obvious area.
Do you mind if I ask a question?
Sure.
Sorry to interrupt, but I'm really curious about this because this picture that we're looking at of the breast is obviously it's of a female. Is the anatomy the same for men as well?
Very similar, yes.
Okay.
Yeah. So that's why it's important for them to check. And the thing we tell men, which we'll talk about in a little bit, is that they need to be breast aware as well. So they just need to be checking the area, knowing what it looks and feels like, and noticing any changes.
Okay, thanks.
Yeah, you're welcome. Good question. Okay, this is a tricky slide, so you're going to just hit it twice now, because that one pops up. Can you hit it again? And again. There we go. So this is the development of the breast ductal tree. So when you're born, you have very few breast cells or breast ducts. Next. Then you can see it starts to proliferate or grow and multiply. Next, please. This is what it looks like after puberty. And then lastly, and this is what happens with the proliferation all the way through after your first pregnancy. So the time that cells are most at risk for these mutations and mistakes to happen is after puberty, right through until after a woman's first pregnancy. And you can see that that's where the greatest amount of proliferation happens, and that's what makes your cells most at risk. So we need women to understand that what they're doing in their teens and early 20s really impacts their breast health later in life. Next, please. So with regards to what causes breast cancer, we know that there's no single factor that causes breast cancer, but we believe it to be a combination of things, with some being more important than others. We know 90% of breast cancers are due to an acquired genetic mutation, which are caused by aging or other factors in the environment. And this second bullet here is probably one of the most important things that I tell people when I speak to them, because most commonly when you try and approach someone about breast cancer or share information with them, something we hear often is that women they say, I don't have to worry because I don't have any family history. When in fact the complete opposite is true, in that more than 90% of people diagnosed with breast cancer have no family history. If you're a woman and you're getting older, those are your two biggest risk factors, plain and simple. It's important to bear in mind that the majority of us have no inherited risk, and we want all women to be vigilant about checking their breasts regularly, so checking their own breasts for what they look and feel like monthly, having an annual clinical exam by their healthcare professional, and once they're 40 or older, to have a screening mammogram. And then again, if you're a man, being breast aware. Again, it's the same, knowing what to look and feel for, knowing what your body normally looks like, so that if there is a change, you notice that change right away. Next, please. So how breast cancer is detected? Currently, screening mammography is our best tool in detecting breast cancer early. In BC right now, it's available to you from the ages of 40 to 79. Women can self-refer, so they can just call and book the appointment themselves. They don't need a doctor's referral. We also encourage you to have an annual clinical exam. Doctors are a little more skilled than you would be for what they're looking and feeling for, so it's best to have that once a year. And then again, the being breast aware, which we stress. There's no right way or wrong way anymore that's really promoted. We just want you checking on a monthly basis, the same time of the month, looking in a mirror, changing your angle a little bit so that you're able to view the whole breast and notice anything that changes. And we'll talk about the changes in a little bit. And then if you notice anything, no matter how minor, report the changes immediately to your healthcare provider. Next, please. So here's a few of the changes that you want to be looking for. So skin changes such as redness, lumps, dimpling, or thickening of the skin. When we talk about dimpling or thickening of the skin, the best way to visualize that is thinking of an orange peel and how it has the little divots throughout it. That's what we mean when we say dimpling or thickening of the skin. Nipple changes or discharge, changes in the size or shape, and unusual pain or swelling. It's really important to know that most of these things, if you discover them, don't mean breast cancer, but it's very, very important that you have your doctor check them out just to rule that cause out. Next, please. So a little bit about the screening mammography program. SMP is under the auspices of the BC Cancer Agency. We have 38 fixed sites in BC with 3 mobile units. And the mobile locations are available online through SMP, so if you're wondering when the mobile unit is coming to your community, it's very easy for you to look up online. Last year they did over 305,000 screens, and again they offer screening currently to women in BC between the ages of 40 and 79, and we're one of the only 6 provinces that do that. Again, you can self-refer, but you do need a family physician for your report. So after you have your mammogram, a report gets sent to you, and a copy of that report gets sent to your healthcare provider as well. The reason for that, if there's any follow-up or something in that report that has to happen, that you have someone that can help guide you through that process and help you to understand it as well. I know for a lot of women in BC, one of our major issues in healthcare is a lot of women don't have a regular family doctor. So there are some clinics throughout BC that will allow you to have the results sent to a walk-in clinic or someone there that can follow up with you as well.
That's really interesting, actually. So you mentioned that you've got mobile units that go to different communities. If a community is interested in having the mobile unit come to them, are they able to contact you to request that? Is that something that you do?
It's something that we're working on.
Okay.
And when I say we, I'm speaking for screening mammography. With the 3 units and costs involved and just the logistics of the layout of British Columbia, it's hard to get everywhere they want to be. So they are trying to increase that, and there has been conversation around getting into the remote areas and that have the need, that have people that want to come and would utilize the mobile unit there.
Yeah, it's good to know.
So again, the results, sorry, can you go back just for 1 second?
Sorry.
That's okay, thanks. The results are mailed to you and your healthcare provider, and then once you're in the program, you'll receive email or mailed reminders when it's time for your next exam. So you don't even have to remember when the last time you went was. They'll help you remind you. So you get the little reminder, put it on your fridge, and you can call to book your next appointment. Thank you. Next. So the goal of SMP is to reduce breast cancer mortality by detecting breast cancer as early as possible. We're going to talk a little bit about this, more about this in a minute. This is just really, really, really important. Over the past year, SMP, as I mentioned, have screened 305,421 examinations while detecting 1,464 cancers. Wow. And since the program's inception, over 17,000 breast cancers were detected through screening mammograms, and almost 85% of those cancers were found in the early stage. And more than 83% were found in women 50 and older. The sad news is that we know only about 54% of the eligible population takes part in the screening mammography, and this number is actually lower in the marginalized and remote areas. So the problem with this is when you have a program that's free, that's accessible for a lot of women, the problem is getting into those marginalized and remote areas to help that 54% go up. And we know from the World Health Organization that if we could get that number from 54 even just to 70%, that we could decrease the breast cancer mortality rate by 30%.
Wow.
And that's only at 70% participation. So
that's amazing.
That's something that's really important. It shows you the value in mammography, and we'll talk about that a little bit more as well. So next, please. So about 2 years ago now, some people may have remembered the huge pink bus that we traveled the province of BC in. It was a 45-foot retrofitted Greyhound bus that was very pink. It was called the Pink Tour, and we traveled around the province of BC educating women about the importance of screening mammography. And while on that tour, we learned a lot of the reasons why women don't participate, in addition to not having access because they are in remote or more marginalized communities that are harder to get to. These were some of the most common reasons we came across. So a lot of women are just simply unaware that they qualify from age 40. And in addition to that, sometimes their doctor is unaware as well. So there's gaps in the knowledge that's out there. And in addition to doctors being unaware, some doctors feel that women don't need to start until they're 50. It's this sort of break in the communication and knowledge that's out there. Everyone's heard stories of how mammograms are painful. We had a tech who came on the bus with us a number of times that explained, on average, out of 100 women, if you polled them, 80% would tell you that they found the mammogram to be mildly uncomfortable. They do use compression. So it does tend to be slightly uncomfortable, but it is very quick. 10% would tell you that it was painful, and 10% would tell you that they really didn't have any discomfort whatsoever. Another reason women don't participate is because they're just too busy. This is one we hear quite a lot. Yeah. You're working, you're taking care of your family, you're taking care of your children's family. Women take on a lot, and a lot of times women take care of themselves last. So a lot of times what we say to women who say that they are too busy is, what would happen to all the things you have to do if you got sick? So we stress the importance of taking that half an hour out of their day to make sure that they're healthy and things are going well, so that if they were to be faced with some sort of diagnosis, they would find it early so that their options were better. Some women say they have thermography instead. So thermography is a thermal image that checks for heat sources in the body. Health Canada has told us that this is not a recognized form of breast cancer screening and that it can't be advertised as so.
Interesting.
Yeah, that was a new update. They don't want to know. Doesn't that work for all of us sometimes? It's just easier if you don't know. Unfortunately, with not knowing, when you don't know, you can't do anything about it. And we know for breast cancer, and most cancers in general, the earlier you find it, the better. The better your treatment options, the more less invasive your treatment options are, the better your survival and your quality of life after. So nobody wants to know, but the value in knowing is that you can actually start doing something about it.
True.
A lot of women believe that radiation from the mammogram can cause breast cancer. This is not true. The radiation from a mammogram has about a 1 in a million chance of causing a breast cancer, and there has been no case proven that that was the case. And the radiation that you receive from a mammogram, we receive radiation every day in everything we do. Sitting here, talking on our cell phones, on the computer, outside, on a daily basis, we are exposed to radiation. The amount of radiation you receive on a mammogram is similar to that on an overseas flight. So I say to women, would you not go on your vacation because you were concerned about your exposure to radiation? No one's going to give up their vacation for that reason. For the same reason, they shouldn't skip their mammogram, especially something that could potentially save their life. Another reason is that they have breast implants. And while it's true that someone with breast implants can't have a screening mammogram, they can have a diagnostic mammogram. So the difference in a screening mammogram is they take 2 images on each side quickly, well, not quickly, but within time constraints. With a diagnostic, they would need to take more time and care to get more views and ensure that there was nothing that the implant may be hiding or something in behind it, and they also would need to take a bit more care to ensure that they didn't bother the implant in any way. But they can still have it. They just need a doctor's referral for that diagnostic mammogram.
I always wondered what the difference was between diagnostic and screening, and now I know. Thank you.
Screening is the idea with screening is that you are screening a healthy person to ensure that everything's fine. Diagnostic is often they're going in to look at something that they're not sure. So they take more images, more time. Yeah. Next, please. So this is an image of a woman going for a mammogram. That's what the mammogram machine looks like. Currently, she is having the straight, the first compression, which is right across. They also take one on a 90-degree angle to get the skin that's in your underarm area as well. So they do each of those images on each side, and then normally you're done. When going for a mammogram, we recommend that you don't wear any creams or deodorants because those can interfere with the film. To wear a button-down shirt, especially for the mobile units. They don't often have the gowns, so if you wear a button-down shirt, that's easy to get on and off. And it's important for us to let women know when they're going for the screening mammography that it is always a female technician. So there's a lot of people that are worried about having a male technician in the room with them. That's not the case. It's always a female technician. Another thing I like to point out for women, because there's a lot of fear of even just going for the mammogram. They don't know what the machine looks like or what's going to happen when they get there. So when you go in, you get changed. You go in, you have this compression done and the 90-degree compression done on each side. And then they often ask you to wait while they check the films. I think it's really important for women to understand that when they go to check the films, there's not a radiologist standing there looking at those films. What they mean is they're checking to make sure they're clear, that the area they were supposed to capture is in the picture and that there's nothing hindering it in any way. So if they call you back in and say they need to get another image, it's not that there's anything or an area of concern at that time. It's just that the image wasn't what it needed to be. So that can be a cause of stress for women when they get called back in and they're not sure why.
No doubt.
Yeah, it can be scary. Next, please. So this is just an image of the 2 different views you get. So the one on the left is the 90-degree angle, and you can see some of the area in the underarm is captured, and then the other one is the straight across horizontal. The other thing that's important to know when you're having the two images, I just completely lost my train of thought. It'll come to me. Next, please. Okay, so here we go with the importance of mammography. So this slide doesn't necessarily do it justice because it's not real size, but this handy little tool that I have here is real size. So the bump at the top shows the average lump detected with routine mammogram. So what routine over your first means is when you have your first mammogram, it acts as your baseline for what's normal for you. So that year after year, when you have your mammograms, they take that mammogram and compare it to your last, so they can see what changes happen for you as opposed to just other women as well. It makes it the baseline for you, which is incredible. So as you go on routine mammograms, it's easy to see the most slight changes for you. So that's the first bump here, which is almost impossible to see.
You know what? I'm just going to switch this for a moment.
Okay.
Because I just realized that our video conference audience might not be able to see that. So what I'm going to do is zoom in here a little bit. There we go.
Hi.
Sorry about that. Now we can see the lumps.
Yeah. So the second one on here is the average size found by the first screening mammogram. This third one, which is getting larger, is the average size of a lump that a healthcare professional would find doing a clinical examination. This massive one at the bottom is the average size of a lump a woman would be able to detect on her own while doing her own self-exam. So the difference between this tiny one up here and this one down here is the difference in mammography. And you think of the amount of time it takes for a lump to grow from here, an average lump, to this. That's a huge amount of time when it comes to the importance of early detection and the size of a lump that you're finding.
So the littlest one that the mammogram can find is about 1.1 centimeters across.
Mm-hmm.
And then the one that we can find by breast self-examination, you're saying, is about 3.6 centimeters by the time that we can actually see it.
Yeah.
Wow. That definitely underscores the importance of going for regular mammograms.
Yeah, this is one of my favorite visual tools I have. So unfortunately, I can't pass it around to all of you to see yourself, but it does really explain to you visually the importance of what you're looking for with a mammogram.
Yeah, it's like almost the difference between a pea and a golf ball, just about.
Yeah, that's a really good analogy. That's exactly what it is.
Okay, so I'll just switch back now, guys, and then everyone can see the PowerPoint again.
Okay, so next, please. Thank you. So here's a little fact or fiction, and some of these we've covered already and some we haven't. But one thing that we hear a lot of is, again, that someone doesn't have to worry because they don't have a family history of breast cancer, which we've talked about earlier. And again, it's more than 90% of people diagnosed with breast cancer have no family history. You're a woman and you're getting older. Those are your two biggest risk factors. Getting breast cancer is beyond your control. This is a bit of a tricky one because it's true and false. So we say it's false in that breast cancer is not beyond your control because there are things you can do to help reduce your risk. The flip side of that is a woman can do everything right and still develop the disease. You can lower your risk for breast cancer by maintaining a healthy body weight. That's true. We know that women, especially postmenopausal women who are overweight, are at 3 times the risk for developing the disease. And the reason for that is fat stores estrogen, and estrogen fuels breast cancer. So the higher estrogen exposure, you're fueling your breast cancer, and the fat is storing that. We talked about this one as well. Having a mammogram will expose you to too much radiation. Again, it's similar to that of an overseas flight, so we know that is false. And now that our equipment is getting better and better and more advanced all the time, the amount of radiation you're being exposed to is actually quite small compared to what it used to be. And the reason that compression is so important is so that they can get the best image possible while exposing you to the least amount of radiation. Having a mammogram can be mildly uncomfortable. We did talk about that as well. In general, people say that it's mildly uncomfortable. If you have if you have sensitive breasts or you're concerned about the pain or you know someone who is, there are a few things women can do. The recommendation is that you can eliminate caffeine for 1 to 2 weeks prior. I say that while clutching my coffee, which I normally walk into my mammogram carrying my coffee. You can also take an ibuprofen an hour or two before your appointment. Also, when you book your mammogram, the person answering the phone will normally ask you about your menstrual period, but ensure that you're booking between your periods and not when you have it, because that increases your breast sensitivity as well. And then lastly, try and remain calm and relaxed, because the more relaxed you are, the more comfortable your body will be and you'll be less receptive to pain. Next is breastfeeding. Breastfeeding can lower your risk for breast cancer. That's true. We know that breastfeeding acts as a protective measure, and we'll discuss that a little bit more in a minute. The next one is men do not get breast cancer. We know that's false. It's about 1% of people diagnosed with breast cancer are men. And actually, one of my very good friend's fathers was recently diagnosed with breast cancer. So it's a difficult process for a man, being that it's often termed a woman's disease, but it does happen. Young women do not get breast cancer. Again, that's false. There was an article published a couple weeks ago about the incidence in young women has increased, and while it's still low comparatively, it has increased in a way that does have people concerned. And oftentimes, breast cancer in younger women tends to be more aggressive, and it tends to be metastatic breast cancer, which is spreading to the other organs in the body quickly. The best learning from that article was when the man said that, as much as it doesn't occur as often, doctors and women need to understand that it can happen and be aware of it. And the importance for that is if a woman who knows her body better than anybody else feels that something is not right, then they need to be their own best breast advocate. I have a very good friend who at 31 years old found a lump, went to her doctor, and her doctor told her not to worry about it. She was 31 years old, it wouldn't be anything. And a year and a half later, she was out in Vancouver visiting, having lunch, and mentioned this to me. And the very family-friendly version of what I told her was to get a new doctor. And within 6 weeks of returning back to Toronto, she was diagnosed with stage 3 triple negative breast cancer. So you think the amount of time that could have been that she could have been diagnosed earlier if the doctor had sort of taken her concerns, or even if the doctor had been more knowledgeable. So it's really important for you, if something doesn't feel right, for you to push for it and advocate. No doctor is going to be upset that you ask for a second opinion, and if they are, too bad. It's your body, your breast health. And lastly, a lump in the breast means that you have breast cancer. So just as when we talked about what the changes you're looking for are, and I mentioned that most things you find are not breast cancer, again, this is false. Most lumps that you find are not breast cancer. But if it's a change for you, it's something unusual for you, it's something you need to bring to your healthcare provider's attention. Next, please. So these are things that float around in emails and urban myths all the time of all the things that we know don't cause breast cancer. There's no scientific evidence that any of these cause breast cancer. Antiperspirants, that's been a big one on and off. Underwire bras, aspartame, lipstick, and the birth control pill. With the birth control pill, it's not 100% conclusive that it doesn't increase your risk, but now the doses of hormones in your birth control pills are much less than they used to be. The caveat I'd say to this is if you have an increased risk, if you have a strong family history, if you have lots of other risk factors, that's something you'd want to discuss with your doctor, and then your doctor could help you determine whether the pill was the best birth control method for you or if you needed to go a different route. Next, please. Speaking of risk factors, so with regards to risk factors for breast cancer, we know that even if you have risk factors, it doesn't mean you'll develop the disease. And again, the other side of that is even if you don't have any of the risk factors for the disease, you may still develop breast cancer. The only exception to this is if a woman tests positive through genetic testing for BRCA1 or 2, which are the gene mutations we know linked with breast cancer. If you're tested for those, your likelihood of developing breast cancer goes up to over 80%.
Wow.
You can't have genetic testing without a lot of genetic counseling. So you're covered with what you do with the results, how you would react, how it impacts you and your family. So it's a good process to go through, but they need to ensure that women are ready for that information and understanding what the results will mean and how it will impact their life. So next, please. So non-modifiable risk factors, these are the things that put us at risk that we can't do anything about. So being a woman, I always joke that, I've heard there's a surgery you can do something about for that, but it's extremely invasive and quite the thing, so most people don't do that. Advancing age, we're all getting older. If someone has a cure for that, let me know. As someone about to turn 40, I'd love to know. Family history, so especially if the woman in your life or the person in your family that was diagnosed was premenopausal. If you have a personal history of breast cancer, so if you yourself have had breast cancer before, you're at an increased risk for developing it again. Early menarche and late menopause, so if you started your period before age 12 or you go into menopause after age 54, that puts you at an increased risk. And the reason for that is you're having regular periods and regular surges of hormones, and again, your increased exposure to those hormones increase your risk of breast cancer. Breast density is another risk factor. So breast density, as it's shown on a mammogram, when we saw the images of the two mammograms before, you could see a white and a black area. Masses on a mammogram show up white. Fat on a mammogram shows up black. So if you have a fatty breast and a mass, the mass really shows up. The limitation of mammography comes in if you have high breast density and a white mass. It's harder to pick up. It's like trying to find a snowball in a snowstorm. It's more difficult. So they have other routes that they can help to complement that test as well. And breast density tends to occur more often in younger women, which is another reason we don't screen women under 40 using mammography. And then breast density itself is an independent risk factor in that women with dense breasts, I think their risk goes up 4 to 6% as well.
Wow.
Yeah. And again, these are the risk factors we can't do anything about. But the good news, next please, are the ones we can do something about. So we talked about body weight before. We know women who are overweight, especially postmenopausally, are at 3 times the risk for breast cancer. And again, that's the fat storing the estrogen and increasing your exposure. Physical activity and a healthy diet. We ask people to have low-fat diets with lots of fruits and vegetables and lots of daily activity, and to also reduce their intake of red meat. When we say daily activity, we're talking 30 minutes a day, 5 times a week of vigorous activity. We want your heart rate up. We want you breaking out in a sweat. And we have mentioned that you can still wear your antiperspirant, so that's a good thing. Smoking. This includes exposure to secondhand smoke. We're talking cigarettes here. Cigarettes have more than 50 different carcinogens in it, with more than 20 of those being mammary carcinogens. So if someone is around someone who smokes, they don't smoke themselves, we sort of recommend that people ask them to step outside to help reduce their exposure to secondhand smoke. Drinking, we know that moderation is the key. The recommendation is a drink, less than 1 drink a day. Higher levels of alcohol is associated with increased risk for breast cancer. We'll talk about that a bit more. Reproduction and breastfeeding. More pregnancies at a younger age provides protection. So this is something when I speak to younger women in schools, you see people getting really panicky that I'm recommending young women to go out and get pregnant early and to breastfeed all their babies. That's not the case, but we do know that the benefit to breastfeeding and having your children younger is the protective measure it takes, because again, you're most susceptible from puberty till after your first pregnancy. So the sooner that happens, you decrease the time you're susceptible. And then another modifiable risk factor is hormone replacement therapy. The current recommendation is taking the lowest dose for the least amount of time. And again, this is a life balance thing for women. If someone is suffering very badly from menopause symptoms and they need to take it, they need to balance that with their quality of life. Again, we recommend if they do need to take it, the lowest dose for the least amount of time. And if you can avoid HRT altogether, then that's even better. So we know that prevention is very important with breast cancer. We're trying to prevent breast cancers from happening in the first place, and these are the ways that you can help control that for you.
I have a question.
Yes?
It's with regards to body weight. You mentioned that there's strong links between being overweight and having breast cancer, and I know that, being overweight is an issue for a lot of folks these days, unfortunately. And I'm just wondering if you can maybe explain a little bit more. What are those links? Like, why is it that people who are overweight are more prone to breast cancer?
It's essentially, as I mentioned, with the fact that fat stores estrogen.
Okay.
And so as you're storing the estrogen, you're increasing your exposure than what it should be, so that increases your risk. Women, especially once they hit menopause and their metabolism slows down, weight issues are a big problem for a lot of women. So it's about being as active as you can be, making smart choices with what you're eating, and then looking after the other risk factors as well.
Okay, interesting. I didn't know that. It was the estrogen.
Yeah.
Cool.
So next, please. A little bit more about alcohol. Your breast cancer risk increases with your alcohol consumption, and it doesn't matter what the drink is. Higher amounts linked with higher risk. So how much of a risk? 4 drinks a day increases your risk 1/3 over a non-drinker. The other side of that is we know that alcohol in moderate amounts may have cardiac benefits. So it's, again, making your life choices, choosing what you want to do. Everybody takes risks in their life every day. They drive too fast, they change lanes too quickly, they don't eat well. People do different things. It's balancing your life, making choices that you're comfortable with, but at the same time having the knowledge to make the choice that feels best for you, making sure you're empowered with that information. And again, doing everything in moderation. People tend to ask me when we talk about alcohol, there's always someone in the corner whose hand goes up and they ask if they can bank their drinks. We recommend 1 drink a day or less. They ask if they can bank Monday to Friday and then consume all their drinks on the weekend. So that's not something we recommend.
No.
Yeah. Next, please. More on breastfeeding. So we know that for every year a woman breastfeeds, she can decrease her risk approximately 4.3%. 6 months is recommended. The more, the better. And then on the next slide, there's a little bit more. Oh, my slide's not there. Okay. So the reason that breastfeeding acts as a protective measure is because most women, when they breastfeed, don't have regular periods. So again, you're not having that monthly surge of the estrogen, which isn't fueling breast cancer. The second reason is because during lactation, old or mature and other cells are shed. And so some of the ones that may have been compromised or may have the mistakes or mutations happening are shed. And so that, again, acts as a protective measure. So those are the two. I know, interesting. So those are the 2 reasons why breastfeeding is protective. So it's good for the baby, and now another reason why it's good for the mom. Next, please. So we know physical activity is important, and here's a quote that I just love. It says, if we could get all adolescent and early adult women to be active with vigorous activity half an hour a day or walking 2 hours a day, we could prevent 1/4 of all breast cancers before menopause. That's amazing. So again, this speaks to why it's important for our younger women, our teens and early 20s to understand that the choices they're making now greatly impact their health overall and their breast health in the future. Next, please. So the challenge is that we need to convince her, meaning our young adult women, to become more active and become breast aware. Everything she does in her teens will have an impact in her future. So it's letting women know in their teens and early 20s who aren't of age for screening mammography that there are things they can be doing, that even at that young age they need to know what their body normally looks and feels like so that they're aware of the changes going forward, and giving them the knowledge of ways that they can reduce their risk so that they can make their best life choices.
Amanda, I'm just wondering if maybe we should take a quick check here and see if there's any questions that anybody has as we go, because I know you have this fabulous presentation, and I think we're kind of about halfway through or so, and it might be a good idea just for a couple minutes if anybody has any questions, because we can't see anybody. We've got the PowerPoint presentation up on the screen, so if anybody out there in video conference land or on Adobe Connect has any questions for Amanda at this point, feel free just to throw on your microphone and ask away. We'd love to hear from you.
Hi, this is Charlotte from Duncan, and
Hi,
I was just wondering, it's Charla.
Charla, welcome.
Thank you. I'm just wondering, for males, do they get screenings at all, like with a mammogram, or?
They don't. The screening mammography program is for women only, but a lot of times if a male presents with something that there's concern that it could be breast cancer, they most often use a breast ultrasound.
Okay, thank you.
You're welcome.
Good question, thank you. Does anybody else have any questions or comments?
Give them time to mute and unmute.
Okay, well, we'll carry on, and if anybody has any questions or comments as we go, just because we can't actually see everybody, just feel free to put your microphone on and ask, and we'll, Amanda can answer them for us. So, alrighty, thanks guys.
Okay, next slide, please. Thank you. So this is along the lines of speaking about young women. We have a website called Don't Forget to Check. It's also an iPhone and iPad app that's free to download. On this website, it tells you again what to check for. They can take a pledge to be breast aware. You can set reminders of when you should do your monthly check and when you should check in with your healthcare provider. And then there's also a Q&A to see what information they know and don't know. And then they also have a fun thing that the younger women tend to like called the boob bomb, which is where you can take sort of, whoa, sorry everyone, cartoon boobs and place them on a photo and then share them via social media or just email or whatever. It's just sort of a fun way to get girls talking to one another. So again, it's our website, and it's also a free iPhone and iPad app as well. Next, please.
I love the name.
The boob bomb?
The boob bomb,
yeah.
That's great.
Yeah.
We'll post the links on our website too as well after, so if people want to go there and send out boob bombs, they
Great,
can.
yeah. So this is just a breakdown on how your risk for breast cancer increases by age. So women between 30 and 39 have a 1 in 233 chance of developing breast cancer. And then as you get down to the 60 to 69 age, it's 1 in 27. So it does increase. And we know that 1 in 9 women will be diagnosed in her lifetime. And we define lifetime as to about the age of 80. Next, please. So ways to reduce your risk that we talked about: getting active. Again, it's 30 minutes a day, 5 times a week, and maintaining a healthy body weight. Limiting your alcohol to 1 drink a day or less. Eating well, 5 to 10 servings of fruits and vegetables, whole grains, reducing your intakes of fat and sugar and less red meat. Don't smoke. If you don't smoke, don't start. And if you smoke, quit. And taking care. Again, for taking care, we mean regular self-checks, having an annual clinical exam, and when you are of the age for screening mammography, participate in the program. Next, please. So these are our lovely round icons to remind you to get active, limit alcohol, eat well, don't smoke, and take care. And if you received any of the materials that I sent to Catherine, you'll see these icons on all of that material as well. Next, please. So essentially in all our messaging, we would like you to replace all of this, which in moderation, most of those look good, minus the cigarettes, with the next slide, which essentially to me looks like the BC lifestyle. I know every time a report comes out, BC is the highest for the healthiest living, and now we're the most likely to buy organic fruits and vegetables. So I don't think it's a stretch for many people who live in BC. Is that a question? Oh, I thought I saw something come up. That's okay. Next, please. So here's a couple of resources we have for people who may be diagnosed with breast cancer or know someone who is. First, we have our breast cancer navigation map, which is an online tool that takes someone through from diagnosis all the way through treatment to survivorship. And you can just go online to the breastcancernavigationmap.com, and everything is available there for you. The second resource is through the Canadian Cancer Society. They have a cancer information and support. It's online, and there's also a 888 number that you can call. They have multiple languages available, and they have a ton of information and resources that they can direct you to no matter what you need. It's invaluable. Next, please. That's just to show you what the landing page of the breast cancer navigation map looks like. So once you get there, it takes you through all the different areas that you need, and it's an amazing resource. Next, please. So just to share a little bit with you about who I am, why I do what I do. I know when Catherine did the introduction, she told you a little bit. This is a picture of my family on Run Day this year in Vancouver, and notice how gorgeous and sunny it was. Normally we do it in the pouring rain, so that was a lovely surprise. On the far left is my son Jacob, who's 6, then myself, my daughter Penny, who's now 3, and my husband on the other end. So as Catherine mentioned, my mom passed away from breast cancer when I was 16. She was diagnosed when I was 12. And at 12 years old, we'd never even heard of breast cancer before. It was 23 years ago that she passed away, and you know, they didn't know as much as they know now. We didn't have the resources we have now. So after she passed away, we started participating in the Canadian Breast Cancer Foundation CIBC Run for the Cure. As an individual participant, then we put a team together and started participating with friends and family and raising lots of money. A number of years ago, I became the team captain. And then 6 years ago, when Mr. Handsome on the left there was born, the floor literally came out from under me. I couldn't see straight of the impact it had for me having a child and not having my mom there. And I knew that I would be impacted by that. But in all the ways that I was impacted, I never suspected. One, to have a child and realize what your mom must have felt as a mother is very difficult, especially to imagine what she would have felt like knowing she wouldn't see us grow up is enough to knock you flat for a while. And then the worry that I wouldn't get to see at the time, my son, and now for me, both my kids grow up, really propels me into action. So I wanted to get more involved. I made an appointment to go into the foundation and speak with the women there, thinking I could sit in the corner and fold some pink ribbons and stuff envelopes, just feel like I was contributing more. And after sitting around the table and chatting about my experience, what I'd done in my life, I left with a stack of job descriptions about this thick, and I became the volunteer run director for the Vancouver run site. And I organized that run for 3 years in a volunteer capacity. And then about 2.5 years ago now, I was offered this position. And I think that I am very, very blessed to get to do what I do, to help give women information to make good choices, to give them the knowledge and power to take control of their lives. And I get to do something, one, that honors my mom every day, and two, helps to ensure that my kids don't know what it's like to grow up without me. So that's why I'm here and why I'm passionate about what I do. And I just think it's really important for women to have that information and to be able to control the choices they make and do it in an educated manner. So next, please. Here's a few other ways that people can get involved. Volunteering, donating, Get Pinked. Get Pinked is our button day. So similar to the Children's Hospital has Jeans Day, we have Get Pink Day. So you purchase a button and you can wear pink or dress casual. You can put a run team together through corporate donations, sponsorship, workplace giving, a community fundraising event, or through planned giving as well. Next, please. And then just a quick mention that this presentation and a lot of what I do out in the community has been supported by PwC, and we're very grateful to them. Otherwise, it wouldn't be, we wouldn't have the resources available to us. Please. Now we'll turn it over for questions. And quickly, I just want to mention that a lot of the communities and health centers should have received this flip chart that was put together by Women's Hospital. It was funded by us. So if you don't have this, you can just contact Women's Hospital and they can probably send you a copy. But it has a lot of the information that we talked about today as well.
What's it called?
It's called Affirming Life Breast Health Screening Education Tool for Aboriginal Women, and it's through Women's Hospital. Go.
Okay, great. Thank you so much for that presentation.
No problem.
Very informative, and I know for myself, I learned a whole bunch of new things that I didn't know before, and definitely a lot of reminders in there that, breast cancer is something that we can, in some senses, control. There are a lot of things we can do, like you mentioned, eating right, exercising, and again, there's some things that we can't control, like genetics, but we just need to do our best and take care of ourselves, and hopefully we won't have to deal with that in our own lives. But I know cancer is something that's touched pretty much everybody's life. If you go down the street, if you talk to your friends and family, pretty much everybody's been impacted. And I know myself that I've gotten involved recently with raising money for cancer research, actually, because my sister-in-law was diagnosed a couple of years ago with non-Hodgkin's lymphoma. So it's a cause that's important, very near to my heart as well. So with that, we would love to invite everybody to ask questions of Amanda or have comments. And I must apologize because earlier I mentioned that I wanted to do some community introductions and then I forgot. So by all means, when you ask a question, please feel free to introduce yourself and where you're from, and Amanda can answer questions if you have any. The floor is all yours.
Comments, sharing stories.
Excuse me, requests for resources, more information.
Yep. Absolutely. Is everybody still awake?
Sure. Is there a question in Skatine?
Good morning.
Oh. Good
Hi.
morning.
Annabelle Pierre from Montcoury.
Welcome.
The community health representative. And we are wondering if you would be able to come to our annual health fair in Montcoury in September.
Oh, I'd love to. September is usually very, very busy, but if you can send me an email, and I think Catherine can share my email, and send me an email with all of the information and dates and that, I can see if we can fit it into the calendar. Absolutely.
That would be really good because that's just before our mobile mammogram comes to the area, and we pretty much serve the surrounding communities.
That would be great. Absolutely. Please send me the information.
We shall do that. Thank you.
Thank you.
So what I can do is, after the presentation, I can send out an email. Is it all right to share the PowerPoint?
Sure.
Okay. So I can send out the PowerPoint presentation, and I'll also send around Amanda's contact information, which is actually also in the PowerPoint as well. So yeah, we can certainly do that, and we'll post the resources on our website.
Great.
So are there any questions on Adobe Connect, or anybody have anything else they want to throw into the conversation? I have a whole list of questions, but I just wanted to give people a chance to, to talk so I don't steal anybody's thunder.
I love seeing all the people taking notes. That's wonderful.
You can always feel free to email us later if you have questions or thoughts. I know sometimes that when I'm listening to a presentation and people ask if there's questions, I don't always have everything at the tip of my tongue. So,
and also I find sometimes people are uncomfortable to ask in a larger group setting. So again, when you have my email contact, you can contact me yourself privately through email or through my phone number, and we can chat that way if you're more comfortable with that.
Actually, I have a question for our audience. I know that, Amanda, you talked about physical activity being really important, and you showed us some pictures of people riding bikes and running, but I'm really curious to hear from our audience about some of the ways that you get active. So I know that maybe you haven't got community centers or facilities that you have access to go to every day. So what are some of the things that you guys do to get active? Because I know I'm a cyclist, so I ride my bike, but you know, I live in Vancouver where we've got weather that's conducive to riding all year round. It may not be the same for everybody who lives, you know, in the north. So what do you guys do to get active? I'm really curious to hear. I see some laughter there.
Hi, this is Michelle in Mount Currie.
Hi, Michelle.
We have a community center here in Mount Currie, so there's a big gym, so a lot of people go in and play basketball. Floor hockey is really big. We also have the Whistler roller derby team practicing in there as well. Our healthy lifestyles program. We don't have a pool in the community, but there's a close one in Whistler, so we can bus people into Whistler with different programs. And I think there's a lot of people just going out walking, and
There's the elders program.
oh, there's elders programs, exercising, and then there's also a First Nations snowboard team. So some people, because we're near to Whistler, so some people do snowboarding as well.
Great.
Roller derby, that is so cool.
Yeah.
We don't even have roller derby here in Vancouver. That's awesome. Are you a member of the team?
Yes, I am a member of the team, yeah. And you do
Oh,
have
great.
roller derby in Vancouver.
That's amazing.
Oh, you have to come to the Learning Circle sometime and do a roller derby demonstration. Or
Well,
you can do it from there.
Oh, that's true.
Or if I come up there in September, I want a roller derby lesson.
Okay, sounds good.
That's awesome. So
Yeah.
yeah, it's nice to hear there are a lot of ways that people can get active, as opposed to not everybody's a runner. I know I'm not a very good runner at all, so you know it's really important just to keep moving. And there's a great example that roller derby
Absolutely.
is something you can do that's it wouldn't necessarily come to mind when you're
Yeah.
thinking about health promotion activities. So that's fabulous. Anybody else have any really cool activities that they like to do to keep active? I saw some arm waving going on in the lower right, lower left-hand corner there. Is that, I can't see the names. It says Skatine. How about you? You'll need to press the button on your microphone if you want to talk. We'd love to hear you.
I think she's speaking. it's not working.
Yeah, I don't think the microphone's working there, unfortunately. And my sign language is not very good. So, yeah, does anybody else have any questions for Amanda?
Here it was. Hear me?
There we
I'm going
go.
on a sun run.
You're going on the sun run.
Can you hear me?
Yeah.
Yes, we are.
Wow. good for
HLSS,
you.
the school here on the reserve. Yes, we're all going. So it's awesome. Kids are all
That's
looking
great.
forward to it.
Great.
So you're all coming
They've
down to
been for
Vancouver?
the last 6 weeks. Yes, on Saturday.
Oh, good stuff.
And the kids have been doing exercises every day for the last 6 weeks. They go out running and jogging and walking every day.
Oh, that's great. I hope the weather holds out for Sunday. We're supposed to get some clouds, but no rain.
Yeah.
That's awesome. Thank you for sharing that.
Yep. I'm Barbara Peters from Sketeen.
Nice to meet you, Barbara. Anybody on Adobe Connect have any questions? Okay, well, like I mentioned, Amanda is available after. If anybody has any thoughts or any questions that they'd like to send our way afterwards, we can certainly make sure that you get connected with Amanda. So, Sketeen, did you mind, I'm sorry, Barbara, did you mind just muting your microphone again for a couple minutes? Thank you. Okay, great. So I guess that's it then. Thank you very much again, Amanda, for coming in and talking to us today and sharing your knowledge with us.
Thanks for having me.
It was great. We learned a lot. So we do have a couple of things to tell everybody about just as we wrap up here. We've got some learning circles coming up. We've been doing a series of regional planning sessions with the First Nations Health Authority around their new mental wellness and substance use planning. So what we're doing are some video conference sessions in advance of the actual in-person regional planning. And so they were here on Monday. They came in to talk to the Vancouver Island region and get some feedback around this new plan that they're coming up with. And they're really interested in hearing from communities all around the province. So if you've got some free time, you're welcome to join us on April 18th. We've got Fraser coming up, the Fraser region. April 24th, we've got Vancouver Coastal Region. April 25th, Interior is invited to come to the circle and share with us. And then on April 29th, we've got the Northern session. So those are all happening from 12 o'clock till 3 o'clock. And we'll be doing it both by video conference and by Adobe Connect. So the information for that is on our website. Can you hit the next slide for me, Jennifer? Thank you. And we're also partnering up with the Strong Conference, which is being presented May 6th to 8th by the First Nations Technology Council. And the Strong Conference is all about technology. So it's about technology, resources, opportunities, networks, and growth. And it's a great opportunity for anybody who's interested in technology, who works in technology. It's for everybody at all levels of interest and expertise and experience. So we're going to be hosting some of these workshops and sessions on the Learning Circle by both webinar and by video conference, and those are going to be free. So please feel free to join us for those upcoming sessions, May 6th to 8th, and we're going to post more information about those on our website coming up very soon. And lastly, for more information about the UBC Learning Circle and for links to information from today's session and also from upcoming sessions, you can find us on the internet at www.learningcircle.ubc.ca. My name is Catherine Berry. I'm the program assistant. So feel free to email me if you have any questions, comments, suggestions about things that you'd like to see in the future on the Learning Circle, or if you'd like to come yourself and present. We're always happy to have people come and share their knowledge. We really appreciate it. So that's a wrap. Thank you very much again for coming, and thanks everybody for being here. Just going to switch back to our video conference session. Okay, have a good afternoon, everybody, and thank you for coming.
Thank you.
Thank you.
Bye.
It's always neat to watch when people hang up. Usually it goes a little bit longer because what they've done in Health Canada is they've actually bridged everybody together and then connected with us.
Oh.
So it's going to keep recording for a little while longer. So we can go like that.